At Gilead Sciences, our ambition to create a healthier world for all people has led to medical breakthroughs once thought impossible, and we continue to set our sights on curing more viral diseases and even certain cancers. That same ambition drives our work to remove barriers to care based on factors like socioeconomic status, age, race and ethnicity, geography, sexual orientation, and gender identity. Every day, Gilead employees leverage clinical expertise, scientific innovation, and community partnerships to enable better access and outcomes for people with the greatest unmet needs. This work is guided by 3 global health equity priorities, which serve as our company's North Star in advancing health equity: helping to enable access to life-changing medicines, delivering scientific innovation to reduce inequities, and igniting social impact for the communities we serve. Now, tackling health inequities is essential to fulfilling Gilead's mission of creating a healthier world for all people and fulfilling our role as a responsible corporate citizen. Our health equity efforts enable us to expand access to innovative therapies among all communities most impacted by the diseases that we seek to prevent, treat, and cure. They are also central to our work to end the HIV epidemic for everyone, everywhere. Now, a key part of our health equity strategy is engaging and collaborating with the medical community to foster more diverse and inclusive healthcare practices that can address inequities in the healthcare system and ensure patients have access to quality care. That is why we were so happy to support the George Washington University's National Clinician Capacity Building effort, the 2-in-1 HIV and COVID-19 screening and testing model. All of their best practices, scalable processes, and value-based decisions have been documented and are now ready to share.
That's right. As the PI for the 2-in-1 model, I'm excited to share that we've been invited to publish an inaugural supplement of 5 scholarly papers for the HPHR Journal, or Harvard Public Health Review. Our goal for publishing with HPHR is to debunk theories that maintain people as problems as opposed to the conditions they live in, as this aligns with the journal's mission to investigate biological, psychosocial, and environmental determinants of health. While this supplement focuses specifically on HIV and COVID-19 prevention, its theoretical frameworks, methods, research, and policy implications have transferability to a wide range of other disparate patient outcomes. These papers illustrate how prioritizing the values and realities of the most marginalized groups is a community-centered approach useful for eliminating discrimination and stigma. That said, that's the title of the supplement: Community-Centered Approaches to Eliminating HIV, PrEP, and COVID-19 Vaccine Stigma and Discrimination. Now, the syndemic interaction between the COVID pandemic with the ongoing HIV pandemic makes visible the role that disparate access to healthcare and other social determinants of health has on one's exposure. This is why this national training effort is called 2-in-1, to equally promote HIV, PrEP, and PEP screening alongside COVID-19 vaccine screening in the same primary care setting. The 2-in-1 model includes primary research, evidence-informed PCP training, and policy recommendations on the screening guidelines. Just like I didn't do this work alone, the papers in this supplement are co-published by the scholars on the research team, by the clinicians on our National Advisory Board, and by the thought leaders who led our speaker series. So head on over to our website to learn more about the webinar we're hosting to debut the supplement and to download your own free open access copy when it's fresh off the press.